Come in.
Good morning, Cindy.
Yes.
Hi, my name is Catherine Kohler, and I'm the chief nurse here of the hospital. Can
Hi.
I come in for a few minutes and talk with you?
Sure.
Okay. So like I said, I'm the chief nurse, and I go out and talk to patients that are getting ready to be discharged, and I heard that's you. And the reason I do that is that we know that Emmanuel is one of the best hospitals in the entire region. But we also know that to stay on top, we have to keep improving all the time. And the best way for us to know what we do well and what we might need to improve upon is to come talk to our patients like you who have experienced our care. So you've been here a few nights?
Yes.
Yeah, like how many? About
I came in on Wednesday morning.
Wednesday mornings. Okay, so a couple nights you've been here. Okay. There's a couple of processes that we have been in the process of hardwiring. And what I mean by hardwiring is every single time they're supposed to happen, we want them to happen. And the first one is called bedside report. And that's where the nurse is going off the shift and the nurse is coming onto the shift, come into your room at your bedside, introduce you to the new nurse who'll be caring for you, talk about what you accomplished that last shift, and that what the plan is for the next shift. What's been your experience with that?
They've all been great. They've come in, introduced even some of the, I think there may be some residents that are following. They've all been come in, introduce themselves, very polite. Great experience.
Okay. So during that bedside report, we want you to be included in that. If there's something that you want to add, we want you to feel comfortable doing that because nobody knows you better than you. And we have also identified that, like, for example, the physician started a patient on a new medication once, and when the nurse came and they talked about starting that new medication, the patient said, "Oh, I'm allergic to that." So we want you to hear what the plan is for your care and understand and contribute to that. Okay, and these are all processes for your comfort and safety. The second process is called hourly rounding, and that's where the nurse intentionally comes in, talks about your comfort level, if you need to roll over, get out of bed, get back in bed, if you have to go to the bathroom, and if you have everything that you need right around you, because we do know that sometimes patients reach for things that they need, they lose their balance and they fall, and we never want you to fall while you're in here. So what's been your experience with hourly rounding?
They've definitely done that. Sometimes it's a little much during the night when you're trying to sleep.
Yeah.
And they do come in and they always make sure that everybody's been in and been great about asking how my pain level and
okay, awesome. Yeah.
they keep right on top of that.
I mean, if you're sleeping, I know sometimes it's hard, even if you are sleeping, that they don't intentionally wake you up, that the door opens, and so I apologize for that. Yeah, and if you're sleeping, there's no clinical need to wake you up, then they can let you sleep. But okay, thank you for that feedback. So when you come to Emmanuel and you choose to stay at Emmanuel, our goal is that we're going to care for you as one of our own, as if you were my daughter, as if you were my sister, my cousin, my aunt. And the inspiration for that comes from an old gospel hymn called "In the Garden," and it's a song about walking